Hello, everyone. Nice to see you guys. So I'm Dr. Amapola McLeod. I'm a naturopathic doctor here at NutriChem.
And I'm Dr. Yousuf Siddiqui. I'm also a naturopath at NutriChem.
So we're so excited to talk to you guys today because there's a lot of momentum around Valentine's Day, and often, there's a lot of promotion of things that aren't super healthy for couples. And Yousuf and I actually treat a lot of couples together. I'll see the wife or one of the partners, and Yousuf will see the other spouse. And we've actually been discussing this a lot, and we find that the patients that see us together end up doing much better, and their results are much longer standing. So it's pretty cool. Have you and we talk about this all the time.
We talk about it all the time. And it's really interesting because, we have these assessment tools, and there's also a lot of parallels when we, like, when Dr. M and I compare notes, we're like, okay, well, we've done an organic acid test on both partners. And when you see actually that there's a lot of similarities, there can be a lot of trending, which actually makes the treatment a little bit easier. Because as Em and I were talking about, we can like build diet plans that are kind of the same for both. Sometimes they're not, but we can work together towards making it a little bit easier on couples. But kind of getting ahead of myself on that.
But it's true. And we were talking about this last night when we were preparing for this, that there's actually studies that show that couples that change together are more likely to have those changes stick, and they're more likely to be successful with those health changes. So there's studies on smoking cessation and weight loss. So those are pretty interesting studies that we are reading. And that's kind of what brought us to wanting to do this discussion today.
And as you know, a fairly large focus of my practice is on men's health. And further to that, men are 57% more likely to die from diabetes. They're more likely to have cardiovascular disease. So building that, guys are pretty sensitive, I have to say, and not necessarily self-driven. And, they're kind of like ostriches, and they put their head in the sand until things get really bad. And one of the reasons why we also wanted to create this discussion was like, how do you support your partner? It could be male, female, whatever. It doesn't matter the gender of the individual, but how do you support your partner into helping them kind of join your bandwagon towards your journey towards health? And
Yeah, exactly. And something that it's so important because the way it ends up happening is I will often see the female partner, and they'll often express to me, I wish I could get my partner and I wish I could get my husband in. I know that they would be really interested in this. And it's really nice to be able to refer to someone who really specializes in men's health, because I think it's important that there's movement together, but each person has their own very individualized treatment that is tailored to them, and not just a couple's plan together. Because part of the growth and the health journey is understanding that working on yourself will have an impact on your relationship as well, and most of the time in a very positive manner.
this is such an important discussion that actually Dr. M and I were having last night about how, say, you're one partner and you're kind of on this journey towards, peeling back the layers of the onion, health restoration, and this really kind of transformative process that a lot of our patients go through. And when you're going through this process and you're in a relationship with someone who's eating potato chips and cookies and lying on the couch, how do you navigate that? And I know that, one of the first questions out the door when I meet with my patients is, are you in a relationship, and is your spouse or your partner supportive? Because it is transformative, right? And it can be quite challenging if you're like, have a ton of sugar addiction and your spouse is eating cake and you're like chewing on some nuts. Like, it's hard.
Exactly. And sometimes it can be, for the other partner, it can be very intimidating to see your partner going through all of these changes. And sometimes there is a natural tendency to kind of retreat a little bit and kind of view it as, oh, they're changing, and there's resistance. And so allowing your partner to kind of come on board in their own way for what's good for them, not based on your own journey, but just having a resource. And we find that, and research shows that the constant reminders, like, you shouldn't eat this, you should eat that, nagging or trying to pull them alongside your own plan doesn't tend to work as well as when someone has their own personal plan to kind of help navigate them through. And so it doesn't seem like one person is just getting tagged on to somebody else. And that's why we find it's so much more challenging than so much more beneficial than one person also feeling like they're trying to change their life, but then they're now also responsible for changing their partner's life. So we don't want to put that on each partner.
Right. And further to that point is that, you know, one of the important things when we look at, so I know both Dr. M and I love objective findings. We love laboratory testing because it allows for truly individual treatment plans. There's an assessment that's specific to your individual body. And if it, I mean, I'm sure you've seen this before. I've seen it 100 times where one person comes in, the other one just follows suit, and they don't get the same result. And the reason being is that, you know, that the treatment plan was geared towards one person, not necessarily the other. But nonetheless, I still love the fact that the other spouse is kind of like experimenting with their health. They're kind of like, okay, I'm gonna be an advocate. I'm gonna be a support. I might not be fully invested the way that our patient might be invested, but at least they have some sort of support and maybe some motivation to start, you know, redirecting their life as well and their health and the way that they view and interact with their own body.
Right, exactly. And you know, not only does and we kind of titled this that your health can actually impact the health of your relationship. So not only will this be good for physical health, but also actually, you know, there's a lot of physical changes that start to happen that we don't really talk a lot about in society of how much of a impact that does have on relationships. So from my side of things, you know, I see a lot of the women who are coming in, you know, they might be in their mid to late 40s, early 50s, lots of sleep disruption happening, waking up in the night, body temperature changes, not feeling rested. That often translates to a lot of anxiety, irritability, quick to snap, and often it's your partner that kind of gets the brunt of that. And so there's a lot of irritability, a lot of hostility between partners, and so working on the physical aspects can really help nourish a relationship when one person isn't going through such intense hormone changes without really understanding what's happening in their body, and just having the language to be able to understand and be able to communicate that with your partner is really, really important. To say, hey, look, I've spoken to my naturopathic doctor and I'm going through really crazy hormone changes right now. And this can be very common in women. It happens and every woman goes through that transition. So, you know, be patient with me. I'm working on it. We're working together to balance things out so I don't feel not like myself again.
Right. And that level of communication is really important.
Yeah. And I think you have those conversations, I'm sure, on the flip side with men as well.
I do, what's really interesting is that, um, you know, and I talk about this again quite a bit. And I actually was part of a panel recently where I talked about men's health and how men's health is a lot more intricate than just testosterone. A lot of men are driven into my practice because they're concerned about their testosterone performance, sexual performance, muscle growth. They think that everything is tied to their T. And when we go through these processes, you know, men's health is equally as, maybe not equally, but it's complicated. It's not as simple as just a single hormone, you know. And we're talking about things like libido, stress, anxiety, performance anxiety. Some men feel quite a bit of pressure, and they don't really talk about it. There's a lot of weight on their shoulders, and that can lead to, you know, feelings of lower motivation and just not feeling like themselves, and a fatigue, and even almost like a minor depression and some anxiety really starts to kind of kick in. And then that then starts this cascade of you know, with men, when anxiety is present, it's very common for them to express it as anger and frustration. And so when Emma was talking about relationships, it's like, imagine if your spouse or your partner is all of a sudden becoming really quite irritable, and then the other spouse is taking it personally when it actually has nothing to do. And then you kind of start this big cascade of lots of arguing and fighting, but the root of it isn't really being addressed.
Exactly. And we have so much support, and this is something that, you know, we always talk about in terms of the way that we practice here. Yousuf already brought it up, more objective findings is there is a lot of support for the mental emotional side, but not a lot of support out there physically for the changes that are happening in your body. And it is a recipe, you know, exactly what Yousuf brought up. If a woman's hormones are changing, her libido often, and when sleep is disrupted, libido often is one of the biggest things to tank. And then plus, if you have someone who, you know, is also tanking on their testosterone and gut function and not feeling great, then you lose that, you know, that passion in the relationship. And again, it's something that doesn't have to just be mental, emotional. There are physical changes that can cause a lot of really, really great improvements. And that's why we wanted to have this discussion today, because it's really not talked a lot about.
No, and you know, it was really interesting. I completed a certification as a sex therapist through the University of Guelph, and the discussions that we're having, a lot of it about the connection was about the behavioral side, right? The reconnect. You know, if someone's been in a relationship for a long time, they're becoming empty nesters. Is the reconnection, and all these different tools to work through that. But as Emma's talking about, one thing that I brought to the table in that course, which was really interesting, was actually the biochemical, biomechanical, those processes in the body that as we age can hinder, that can slow things down. And that plays a huge part in how we feel in our body. If your body's operating at like 40%, how are you going to really, you know, embrace life when you have this weight that's weighing you down?
Exactly. And we see that so often. And even, you know, we always have to bring gut function and digestive health into every discussion we have, but how are we supposed to expect ourselves to feel good about what we're doing if we're constantly bloated and gassy? And then if you're changing, but then you're making multiple different meals for different people in your family, it can add a lot more stress. So, you know, working together and being encouraging and showing the positive change that you're having in your life, and, you know, being able to tell your partner, look, there are specialists that deal with men's health in particular, and they can address how we are operating together as a couple. And that can be a priority in your consultation, or that can be a priority if that's something that you want to work on. You know, it's important that we bring these things up because sometimes they do get swept under the rug a little bit.
100%. Um, I don't know. It kind of goes back to this philosophy about individualistic healthcare, where you treat the individual. You know, one thing that we definitely that we've created, I believe that we've created, this is my bias, a well, and is an arena of no judgment. You know, nothing really phases us. We've heard it all, and I think what's really important is to find a practitioner, regardless of who it is, that you feel completely safe with, that you can, you know, work through these processes, these biochemical, but also, you know, I know that in my visits with my patients that, like, you know, there's always my tools that if you're a patient of mine, you know, like I have these like clear things that I do to measure your progress. But a lot of it is also just talking about like life and how you're kind of moving through this transformative journey that we're working through. And I think when you're kind of opening this door, opening Pandora's box and diving a bit deeper into who you are, partnering up with a practitioner that you feel comfortable, that you feel safe with, is really, really important.
Yeah. And again, I think, you know, you kind of brought it up. It is really all about empowering patients and empowering them to empower others, that you do have control over your body. Not every single aspect, but sometimes we forget with aging and changes that happen gradually over time. They're not huge dramatic changes. We sort of just view them as part of us, and we forget that, wait a minute, we can change this. We have the ability to create drastic change within ourselves that will reflect in beautiful transformations in health. And when others start to see that, you know, it will make every aspect of your life always more positive, because yeah, yeah. So I guess that's a good message for us to kind of end on.
Yeah.
Instead of making it more a negative thing with your partner, you should do this, we need to do this, empowering them, showing them the positive changes, showing them how you learning about your body has made such a huge impact on you.
And that there are resources available to help support you through these processes, and that it's important to note that these processes are they're I mean, I keep using the word. It seems to be my word of the morning for the day, but transformation, right? And so, I'm really excited about it. I love relationships. I think that they're like these amazing tools to help us kind of overcome our own barriers with unconditional support, and yeah, I mean, I think it's great.
Yeah, and I love it. They're like, oh, I'm sending my spouse. So it's really cool. A lot of my women patients will ask to send their spouse to me. And I say, I'm going to refer them to Dr. Yousuf, because I think it's kind of neat for people to have their own individual practitioner. And especially, I'm extremely passionate about women's health, but I'm not as fluent in men's health. I don't think you can know everything in every field. And I think it's important to have more of a niche specialty that you really, really resonate with. And so that's what's kind of cool, and vice versa. I know you're sending me all the partners as well. So it's kind of naturally happened, and that's why we wanted to talk about it. And I think it's very timely around Valentine's Day, because we do put a little bit more focus on the relationships in your life. So yeah.
And and it's great, and we work collaboratively, so it's not uncommon for Em and I to like chat about cases, with our patients' permission, of course. But yeah, happy Valentine's Day to everybody who knows.
Happy Valentine's Day. And hopefully this brings some motivation to get, some inspiration for your partner, or show them this video, just so that it can open the conversation about moving forward together on your health journey.
Yeah, it's great. And we look forward. If you have any questions, feel free to contact the clinic.
Comment below, and I'll put the link to one of the studies as well. So have a great day, everyone, and thanks for tuning in.
Bye.